Thank you, Madam Speaker. Recently, we were approached by Heather Houston, who is sitting in the gallery today, with the story of what happened to her father. In the morning of June 26, 2018, he was taken by ambulance to the Seven Oaks Hospital with signs of a stroke. A CT scan missed it. He was discharged and prescribed Gravol. By 10 that night, he couldn't walk. He was taken to Misericordia Urgent Care, which had lost much of its staff because it was in mid-transition. Misericordia suspected a massive stroke, but there were no beds available. He was sent home, ended up at St. Boniface the next day, where 31 hours after his first hospital visit, a stroke was confirmed. 31 hours and 3 hospitals for a stroke. It's not enough to say that change is hard. Does this government measure the negative impact of their healthcare changes on patients' dignity and care?
The Honourable Minister of Health, Seniors and Active Living.
Thank you, Madam Speaker. That member knows that if he has a casework that he wants to raise, that my door is open and my staff would be willing to look at this. The member also knows that probably the best examination of a particular piece of casework is not done on the floor of the legislature. But that member also knows that our government is making good investments in healthcare and correcting years of a system that was poorly aligned and had the worst wait times in Canada. We're making progress and getting better results.
Hear, hear.
The Honourable Member for St. Boniface on a supplementary question.
Madam Speaker, Ms. Houston's father also had a hard time in some personal care homes, and the government's own numbers are clear. While we have an aging population and people are living longer, and there are people who have greater needs, there are people who should be cared for in hospital or palliative care who are being moved into personal care homes instead. The Premier recently wrote asking federal party leaders to commit to more healthcare funding, yet actual spending on health and personal care homes has been frozen for the last 3 years, which I table. The federal government is increasing funding at 3% a year. Why is the Premier asking for more health transfers from the federal government when provincial spending on healthcare has been flatlined? Will the Premier commit to using those federal funds to improve training and increase staff in personal care homes, or will we still see more years of frozen funding?
The Honourable First Minister.
First of all, I'll offer my condolences on behalf of our caucus to Heather on her loss and on the tragedy that befell her family. I want to say, though, Madam Speaker, it is always wrong for a member to use a personal tragedy experienced by a Manitoba family in this chamber to try to score political points, as the member has just done on 2 questions. I would say to him that if he would join with us and the NDP, who've agreed that the lower levels of federal partnership funding for healthcare are a concern, if he would join with us and make that unanimous in this House, that would be helpful to increase the strength and the sustainability of our healthcare system, so situations like this would be less likely to happen again in the future.
The Honourable Member for River Heights on a
Madam Speaker,
supplementary question.
Heather Houston's father had 22 falls while he was at St. Boniface Hospital, Parkview Place, and Middle Church personal care homes. This is an extraordinary number of falls. My sense is that the reason for this many falls is that more staffing is needed, as is more training specific to prevention of falls. Ideally, a person like Heather's father should be able to be in these institutions without a single fall. I ask the Minister, what is he going to do to eliminate such accidental falls in Manitoba's healthcare facilities?
The Honourable First Minister.
Here we go again, Madam Speaker, with a shameful abuse of a situation that calls for higher thinking. I would ask the members opposite to understand in the Liberal caucus that we have had premiers all across this country, regardless of political stripe, Liberal premiers, New Democratic premiers, Conservative premiers too, have asked repeatedly for a meeting with the Prime Minister to discuss health care funding, the number 1 priority for Canadians. And we can't get a meeting with the Prime Minister of Canada 4 years in a row, back to back to back to back. Madam Speaker, part of the reason that this chamber has not got unanimous support for such a measure used to be that we had 2 independent members here. But we don't anymore. And now we simply need the Liberal caucus to join with the NDP and the PCs and ask for a meeting with the Prime Minister to discuss healthcare funding so we can move forward together in a partnership to strengthen the quality of care for all Manitobans.